If you're over 60 and walking is your main form of exercise, you've probably been told the same thing for decades. Just keep walking. Walking is the best exercise for seniors. It sounds safe, it sounds simple, and it sounds right. But here's what doctors are now quietly warning seniors about. Walking is not the problem. The mistake is believing that walking alone is enough to keep your body strong, stable, and independent as you age. And if no one has ever explained this to you before, this is not your fault. For years, walking was promoted because it helps the heart, improves circulation, and feels safe. But orthopedic surgeons, geriatric specialists, and researchers are now seeing a troubling pattern in adults over 60 who only walk. They're losing strength, they're losing balance, and many are shocked when simple daily movements suddenly feel difficult. Standing up from a chair, climbing stairs, catching yourself before a fall, carrying groceries without pain. Here's the uncomfortable truth doctors don't always say clearly: walking keeps you alive, but it does not stop the muscle loss, balance decline, and joint weakness that quietly accelerate after 60. In fact, some specialists now say this common walking mistake is one of the reasons so many active seniors are still ending up with falls, fractures, and loss of independence, even though they did everything right. And this is the most important part. This does not mean you should stop walking. It means your body has been missing a few critical pieces, pieces that are simple, safe, and already used by surgeons in rehabilitation and fall prevention programs. Once you understand what walking doesn't train and what your body truly needs after 60, you can dramatically reduce your risk of falls, protect your joints, and feel more confident in everyday movement again. And we're going to break it down step by step in a way that feels doable, not intimidating. No gyms, no extreme workouts, and no fear-based fitness advice. Before we dive deeper, take a moment to tell us in the comments your age and where you're watching from. This helps us create content that truly supports healthy aging. And if staying strong, mobile, and independent after 60 matters to you, subscribe so you don't miss our upcoming senior health guides. Now let's talk about why this walking advice became so common and where it started to go wrong. Why walking became the gold standard for seniors. To understand why doctors are now warning seniors about this common walking mistake, we need to go back a few decades, back to when this advice actually made sense. For a long time, walking was promoted as the safest, most practical exercise for older adults. And to be fair, it still has real benefits. Walking improves circulation, supports heart health, helps regulate blood sugar, and keeps people moving rather than sitting all day. For many seniors, it felt achievable. You didn't need equipment, a gym membership, or special training. You just needed a pair of shoes and a sidewalk. So doctors encouraged it, families encouraged it, community programs built entire routines around it. But here's the part that rarely gets explained clearly. Walking was never designed to preserve strength. It was never designed to protect balance reactions. And it was never designed to maintain the muscles that keep you independent. Medical advice often focuses on what is safe, not what is complete. Walking checked the safety box, but as researchers and orthopedic specialists began studying aging more closely, they noticed something alarming. They were seeing seniors who walked every day, sometimes for years, yet still struggled to stand up from a chair without using their hands. They hesitated on stairs, they shuffled their feet, they fell on uneven ground. And many were confused because they believed they had done exactly what they were told. This is where the misunderstanding began. Walking trains your heart and lungs, but it barely challenges the muscles responsible for standing, balancing, and reacting quickly. After age 60, those muscles don't just weaken slowly, they weaken selectively. The body prioritizes efficiency, and if muscles aren't challenged in specific ways, they quietly shut down. That's why surgeons and geriatric specialists often say movement is not the same as training. You can be active and still be undertrained. This is not about being lazy. This is not about doing something wrong. This is about incomplete guidance. For decades, the message was simple: walk more. But aging is not simple. And the body after 60 needs more targeted signals, signals that tell it we still need strength, we still need balance, we still need control. When those signals are missing, the body adapts in ways that don't show up right away. The decline is quiet, gradual, easy to ignore until one day it isn't. And this leads directly to the problem doctors are now most concerned about, the one walking alone cannot stop. Because once we understand what's really happening inside the aging body, the warning starts to make sense, and the solution becomes surprisingly clear. In the next chapter, we are going to talk about the silent process that begins after 60, why walking doesn't slow it down, and why doctors consider it one of the biggest hidden threats to senior independence. The silent process, walking can't stop after 60. There is a process happening inside the body after age 60 that most seniors are never clearly warned about. It doesn't cause sudden pain, it doesn't show up overnight, and it often goes unnoticed until everyday life starts feeling harder than it should. Doctors call it age-related muscle loss or sarcopenia. Now, this word rarely gets mentioned in casual health advice, but orthopedic surgeons and geriatric specialists pay very close attention to it because it is one of the strongest predictors of falls, fractures, and loss of independence in older adults. Here's what makes it so dangerous. Sarcopenia doesn't announce itself. It begins quietly. Muscle strength starts declining as early as your 50s, and after 60, that loss can accelerate. Research consistently shows that adults over 60 may lose 3 to 5% of their muscle mass every year if it isn't challenged properly. Not because they're inactive, but because the right muscles aren't being trained. And this is where walking falls short. Walking uses momentum more than muscle. Once your body adapts to the same pace and pattern, your muscles stop receiving a strong signal to stay powerful. There is very little resistance, very little balance demand, and almost no controlled lowering, the exact type of muscle action doctors say protects joints and prevents falls. What happens instead is subtle. 1. You may notice it first when 2. Getting out of a low chair takes more effort. 3. You push off with your hands without thinking. 4. Stairs feel harder than they used to. 5. You hesitate when stepping off a curb. 6. You feel less steady on uneven ground. Most people assume this is just getting older, but doctors know better. These are not signs of aging, they are signs of missing strength signals. And here's the part that surprises many seniors. Walking does not stop this process. You can walk every day and still lose the muscle that keeps you upright, balanced, and safe. In fact, surgeons often see patients who are very active walkers but still fail simple strength and balance tests before surgery. This is why falls remain one of the leading causes of injury in adults over 60, even among those who consider themselves active. But let's be very clear about something important. This is not meant to scare you. Fear alone helps no one. Because the same research that identifies this problem also brings very good news. Muscle loss after 60 is not permanent, it is not inevitable, and it responds quickly when trained the right way. Doctors now know that even light controlled strength and balance movements done safely and consistently can dramatically slow, stop, and even reverse much of this decline. In many cases, seniors regain confidence faster than they expect. This is why modern rehabilitation programs don't rely on walking alone anymore. They focus on specific movements that tell the body, we still need you to be strong, we still need you to be stable. And once those signals return, something powerful happens. Everyday tasks feel easier. Fear of falling decreases, and independence becomes something you actively protect, not something you hope to keep. So if walking isn't enough to stop this silent process, what exactly is the mistake doctors are warning seniors about? That's what we're going to uncover next, because once you see it clearly, everything starts to make sense. In the next chapter, we'll reveal the exact walking mistake most seniors make, why it's so common, and how to fix it without giving up walking at all. The exact walking mistake doctors are warning seniors about. Now that you understand what's quietly happening inside the body after 60, we can finally name the mistake doctors are talking about. And it's not what most people expect. The mistake is using walking as your only form of physical training. not as part of your routine, not as something you enjoy, but as the only thing you rely on to stay strong and independent. And this mistake is incredibly common because it sounds reasonable. Walking feels productive. It raises your heart rate. It gets you outside. It feels like you're doing something right. Many seniors even walk faithfully every single day, believing that consistency alone is enough to protect their body. But doctors are now very clear on this point. Movement is not the same as training. Walking moves your body forward, but it does not challenge your muscles against resistance. Train your balance reactions, strengthen the muscles that stop a fall, protect bone density, teach your body how to control movement. In medical settings, walking is considered baseline activity, not protective training. This is why orthopedic surgeons often say something that surprises patients. Your heart may be fit, but your legs are not strong enough to support you safely. And this doesn't show up on a step counter, it shows up in real life. It shows up when you grab furniture for support without realizing it, you avoid stairs when possible, you feel anxious on uneven ground, you hesitate before stepping backward or sideways. Walking almost always happens in a straight line, at a comfortable pace, on predictable ground. But life doesn't work that way. Falls don't happen while you're walking calmly down a sidewalk. They happen when you turn suddenly, lose balance, reaching for something, step on an uneven surface, trip and need to react instantly. And here's the critical point doctors emphasize. Walking does not train your body to recover from imbalance. That recovery, the ability to catch yourself, stabilize, and regain control, comes from specific muscles and movement patterns that walking barely touches. This is why many seniors are shocked after a fall. They say, "But I walk every day." And doctors respond with compassion but honesty. Yes, but walking alone doesn't prepare the body for unexpected movement. This isn't a failure on your part, it's a gap in the advice you were given. For years, mainstream fitness messaging simplified senior health into one safe instruction. But aging bodies need more targeted care. They need strength signals, balance challenges, controlled movement, not intensity, intention. And once doctors began testing seniors who only walked versus those who walked and did simple strength and balance movements, the difference became impossible to ignore. Which brings us to the next important question. If walking alone leaves key weaknesses untrained, where does the damage show up first? Because the body always gives warning signs if you know where to look. In the next chapter, we'll break down the real-life warning signs doctors see first, the ones many seniors overlook, and why catching them early can prevent years of struggle later on. Where the damage shows up first, the warning signs most seniors miss. One of the reasons this walking mistake goes unnoticed for so long is because the body doesn't fail all at once. It sends small signals first, quiet ones, signals that are easy to dismiss or explain away as just aging, but doctors and physical therapists know exactly where to look, and once you understand these early warning signs, you'll start noticing them everywhere, not just in yourself but in people around you. Here's what they watch for first. 1. Difficulty standing up from a chair. This is one of the earliest red flags. If you find yourself rocking forward, using your hands on your thighs or pushing off armrests, it means your leg and hip muscles are no longer producing enough force. Walking does not strengthen this movement because walking never asks your body to lift its full weight from a seated position. 2. Hesitation on stairs require controlled strength, especially when stepping down. Doctors pay close attention to this because stair hesitation often reveals weakness during the lowering phase of movement. Walking on flat ground does not train this kind of control, which is why stair confidence often fades even in regular walkers. 3. Shuffling or shorter steps. Many seniors don't realize their steps have shortened over time. This isn't a habit problem, it's a stability problem. When balance muscles weaken, the brain shortens stride length as a protective strategy. Walking more does not fix this because the underlying stability muscles remain undertrained. 4. Needing support while standing still. Holding onto a counter while brushing teeth or leaning on a wall while waiting is not about fatigue. It's about balance endurance. Standing still is actually harder for the nervous system than walking, and walking does not prepare the body for this demand. 5. Fear of uneven ground. Gravel, grass, wet floors, or small curbs suddenly feel dangerous. This fear is not psychological weakness, it is the brain recognizing that the body may not be able to correct itself quickly if balance is lost. Walking on predictable surfaces does not build this protective response. 6. Slower reaction when you trip. This one is often invisible until it matters. When balance is challenged, the body must react instantly. Doctors call this reactive strength. Walking does not train rapid correction, which is why falls often happen even in people who walk daily. 7. Increased stiffness after sitting. Standing up feels harder after sitting for a while. Muscles that aren't regularly challenged lose elasticity and readiness. Walking warms the body but does not restore this lost responsiveness. What makes these signs especially dangerous is that they don't feel urgent. You can live with them for years. You adapt. You avoid certain movements, you move more carefully. But adaptation is not the same as protection. Doctors see this pattern repeatedly. Seniors adjust their lives around declining strength instead of restoring it. And eventually, one unexpected moment exposes the weakness, often with serious consequences. Here's the reassuring truth: these warning signs are not permanent damage, they are signals. And signals mean opportunity. Once the right movements are introduced, many of these issues improve faster than people expect. Confidence returns, fear decreases, daily life feels manageable again. But first, you need to understand why walking alone never corrected these issues in the first place, and what kind of movement actually does. In the next chapter, we'll explain what walking completely misses, why doctors don't rely on it in rehabilitation, and the exact types of movement your body has been asking for all along. What walking completely misses and why doctors don't rely on it alone. At this point, the picture is becoming clear. Walking keeps you moving, but it leaves critical systems untrained. And this is exactly why doctors do not rely on walking alone when they are trying to restore strength, prevent falls, or protect independence. To understand why, we need to look at how the body actually stays upright and safe. Your ability to move confidently through daily life depends on several systems working together. When even one of them is neglected, the body compensates in ways that increase risk. Here is what walking completely misses. 1. Resistance against your own body weight. Strength is built when muscles are forced to work against resistance. Walking uses momentum, not resistance. Once you adapt to your normal pace, your muscles stop receiving a strong signal to stay powerful. Doctors know that without resistance, muscle tissue slowly shuts down even in active seniors. 2. Controlled lowering of movement. This is one of the most important and least discussed aspects of strength. When you sit down, step down from stairs, or catch yourself during a trip, your muscles must slowly control your body weight. Walking does not train this skill. Surgeons emphasize controlled lowering because it protects joints and prevents sudden collapse during slips. 3. Single leg balance. Every step in walking briefly uses one leg, but the demand is minimal and predictable. Real balance requires holding your body steady on one leg when something unexpected happens. Doctors specifically test single leg stability because it strongly predicts fall risk. Walking does not challenge this system enough to improve it. 4. Side to side and rotational control. Life is not linear. You twist, reach, turn, and pivot every day. Walking mostly trains forward motion. The muscles that stabilize your hips and spine during sideways or rotational movement remain underdeveloped when walking is the only activity. 5. Rapid corrective responses. Falls are prevented in fractions of a second. The body must sense imbalance and respond immediately. This requires strength and coordination working together. Walking does not train fast reactions, which is why even confident walkers can fall suddenly. 6. Bone loading signals. Bones stay strong when they experience varied forces. Walking provides repetitive, low-level impact. Doctors know this is often not enough to maintain bone density after 60. Controlled resistance and balance movements send stronger signals to bones to stay dense and resilient. This is why walking is rarely used as a primary tool in rehabilitation programs. After surgery, injury, or hospitalization, doctors prescribe specific movements that rebuild strength, balance, and control first. Walking is added later once the body can support itself safely. So the issue is not that walking is bad, the issue is that walking is incomplete. When seniors rely on walking alone, these missing systems quietly weaken, and the body responds by becoming cautious, stiff, and less confident. But here's the hopeful part. The movements that restore these systems are not extreme. They are simple, controlled, and safe when done correctly. They can be done at home. Many are done with a chair or a wall, and they don't require long workouts. This brings us to the turning point. If walking misses these essential elements, what should replace them? What movements do doctors actually recommend to fill the gap? In the next chapter, we'll begin breaking down the exact types of movements walking misses, starting with the one doctors consider the foundation of independence after 60. The foundation doctors focus on first, standing strength. When doctors and physical therapists evaluate seniors, there is one movement they pay attention to before almost anything else. Not walking speed, not step count, not how far you can go. They look at how you stand up. This single action tells them more about your future independence than most people realize. Here's why. Standing up from a chair requires coordinated strength from the hips, thighs, core, and ankles. It demands balance, it demands control, and it demands confidence. If this movement weakens, everything else in daily life becomes harder. Doctors know this, which is why standing strength is often the first thing addressed in rehabilitation, fall prevention programs, and post-surgery recovery. Walking does not train this movement. When you walk, your body never has to lift its full weight from a seated position. It never has to generate force from a dead stop. And it never has to control the transition from low to high posture. As a result, seniors who walk regularly can still lose the ability to stand smoothly and safely. Here's what doctors watch for. 1. Needing momentum to stand. Rocking back and forth before standing is a sign that muscles are no longer producing enough force on demand. This is not about effort, it is about missing strength signals. 2. Using the arms without realizing it. Pushing off armrests or thighs often happens automatically. Doctors see this as a compensation pattern. It means the legs are asking for help. 3. Standing feels harder after sitting longer. This indicates reduced muscle readiness. Walking warms the body but does not restore this lost responsiveness. 4. Standing feels unstable for the first few seconds. That brief wobble matters. It tells doctors that balance systems are not engaging quickly enough. Now here's the critical point. Doctors don't address this problem by telling seniors to walk more. They address it by restoring sit-to-stand strength. This movement is considered a foundational skill because it affects nearly everything: getting out of bed, using the bathroom, getting in and out of a car, rising from a couch, recovering after a stumble. When this skill improves, confidence improves with it. Seniors move more freely, fear decreases, daily life feels manageable again. And this is where many people feel relieved, because restoring this strength does not require heavy weights or aggressive workouts. Doctors often start with very simple versions, using a chair, moving slowly, limiting repetitions, focusing on control. What matters is not intensity, what matters is intention. The body needs to be reminded how to produce force again. Once it receives that signal, it responds, even after 70, 80 and beyond. But standing strength is only the beginning. Even if your legs are strong, there is another system that walking almost completely ignores, and doctors consider it one of the biggest predictors of falls. In the next chapter, we'll talk about balance in a way most people never hear explained, and why walking does almost nothing to protect it after 60. Balance is not automatic after 60, and walking doesn't protect it. Most people assume balance is something you either have or you don't. If you can walk without falling, you must be fine. That belief is one of the biggest reasons balance declines unnoticed in adults over 60. Doctors see balance very differently. Balance is a trainable system, and like strength, it weakens when it isn't challenged in the right way. Walking feels balanced because it is predictable. You move forward at a steady pace, usually on flat ground, with both feet spending very little time fully supporting your body alone. The brain quickly memorizes this pattern and the balance system goes into low alert mode. But real life balance is rarely predictable. It is tested when you turn suddenly, you reach sideways, you step back, unexpectedly, you lose footing for a split second. Walking does not train these situations. This is why doctors often say something that surprises seniors. Good walkers can still have poor balance. Here's what balance really depends on. 1. Single leg stability. Every fall begins on one leg. If your body cannot stabilize itself on one leg when balance is challenged, recovery becomes difficult. Walking touches this skill only lightly and never challenges it enough to improve. 2. Ankle reaction strength. Ankles are the first line of defense when balance is lost. After 60, ankle muscles weaken rapidly if not trained directly. Walking on flat surfaces does not strengthen these reactions. 3. Hip control. The hips act as stabilizers for the entire body. When they weaken, the body becomes cautious and stiff. Doctors test hip stability because it strongly predicts fall risk. Walking does not activate these muscles deeply enough. 4. Balance endurance. Standing still can be harder than walking. Many seniors can walk but struggle to stand in one place without support. This is a sign of declining balance endurance, not weakness of will. 5. Confidence of the nervous system. Balance is not just muscular, it is neurological. The brain needs exposure to small, safe balance challenges to maintain quick response times. Without this exposure, reactions slow. Doctors don't wait for a fall to train balance. They train it before something happens. And this is the part many seniors find encouraging. Balance training does not mean risky movements or standing on one leg without support. In medical settings, it often starts with very gentle challenges, standing near a counter, lightly holding a chair, shifting weight slowly, short, controlled holds. The goal is not to scare the body. The goal is to wake it up. Once balance begins to improve, something important happens. Fear decreases, movement becomes smoother, confidence returns, but even balance training alone is not enough. There is one more missing piece that walking completely skips, and doctors consider it essential for protecting joints, preventing falls, and maintaining control. In the next chapter, we'll explain the kind of muscle action most people have never heard of, why surgeons emphasize it, and why walking does not train it at all. The type of strength walking never trains but surgeons emphasize most. There is a specific kind of strength doctors and surgeons pay very close attention to, especially in adults over 60. Most people have never been taught about it, yet it plays a major role in preventing falls, protecting joints, and maintaining control during everyday movements. This is called controlled lowering strength. You experience it every day even if you've never named it. When you sit down into a chair, step down a stair, lower yourself onto a bed, catch yourself when you trip, your muscles are working to slow your body down, not push it up. Doctors call this eccentric strength, and it is one of the first types of strength to decline with age if it isn't trained. Walking does not train this at all. When you walk, gravity does most of the work. Your body folds forward slightly, and momentum carries you through each step. The muscles are not required to slowly control your body weight in a meaningful way. Over time, the nervous system stops prioritizing this skill. Surgeons emphasize controlled lowering for one simple reason: this is where falls are either prevented or allowed to happen. If the muscles cannot slow your body down during a misstep, the result is often a sudden collapse rather than a controlled recovery. This is why doctors see more injuries during stair descents than ascents, and why sitting down can feel harder than standing up. Here is what doctors notice first. 1. Plopping into chairs. Instead of lowering smoothly, the body drops. This is not carelessness, it is missing control. 2. Fear of stepping down. Curbs and stairs feel more dangerous than stepping up. That fear comes from weakened lowering strength. 3. Joint discomfort during daily movement. Without muscle control, joints absorb more force. Over time, this leads to pain and instability. 4. Slow recovery from small stumbles. When the body cannot control descent, it cannot recover quickly. This is why rehabilitation programs focus heavily on slow, controlled movements. Surgeons know that teaching the body how to resist gravity again is critical for safety. The encouraging part is this controlled lowering strength responds very quickly to training. Even gentle exercises performed slowly can rebuild this skill. No heavy weights, no fast movements, just intentional control. And once this type of strength improves, many seniors notice immediate changes. Stairs feel safer, chairs feel easier, joints feel more supported, confidence increases, but we're not finished yet. There is still one more critical element walking leaves untrained, and doctors consider it the final piece that ties strength and balance together. In the next chapter, we'll reveal the missing link doctors look for before clearing seniors for independent movement and why this final piece brings everything together. At this stage, you've seen how walking alone leaves important systems untrained, standing strength, balance, reactions, controlled lowering. But doctors know that even when these improve, there is one final link that determines whether seniors truly move with confidence or continue to feel cautious. This link is stability under load. In simple terms, it means your body's ability to stay steady while doing something else. Real life is not practiced in isolation. You are rarely just standing, just balancing, or just moving. You are doing things at the same time, carrying groceries, turning while walking, reaching for an object, stepping aside to avoid someone, changing direction. Unexpectedly, walking does not train this. Walking keeps your hands free, your posture predictable, and your movement repetitive. Doctors know that the moment an extra task is added, many seniors lose stability, not because they are weak, but because the body was never trained to manage combined demands. Here is what doctors look for when testing this skill. 1. Carrying objects while moving, holding weight changes your center of gravity. Without stability training, balance becomes uncertain. 2. Turning the head while walking. Looking sideways or behind you challenges the nervous system. Many falls happen during turns, not straight walking. 3. Reaching while standing. This shifts weight unexpectedly. If stabilizing muscles are weak, balance is compromised. 4. Quick direction changes. Life rarely gives advance notice. Stability under load determines whether the body can respond safely. This is why surgeons and physical therapists often include very simple multitask movements in rehab programs. Not to push limits, but to teach the body how to manage everyday complexity again. The goal is not perfection. The goal is preparedness. When stability under load improves, seniors report something important. They stop thinking about every step, movement feels natural again. Fear fades into the background. This is the moment when walking starts to feel supportive again instead of risky, because it is no longer doing all the work alone. And this leads us to the most important question of all. How do you put this together safely without giving up walking and without overwhelming yourself? In the next chapter, we'll show you how doctors actually combine walking with these missing elements, using a simple weekly structure that protects independence and keeps the body strong after 60. How doctors recommend walking after 60, the right way to do it. After everything you've learned so far, this part is crucial because doctors are not telling seniors to stop walking. In fact, when walking is used correctly, it becomes a powerful tool for longevity, circulation, and mental health. The problem was never walking itself. The problem was relying on walking alone. Doctors now recommend a supportive role for walking, not a protective one. Here is how walking fits safely and effectively into a complete senior health routine. 1. Walking is for the heart, not for strength. Doctors use walking primarily to support cardiovascular health, blood flow, and endurance. It keeps the heart strong and the lungs active, but it is not prescribed to build or maintain muscle. Once this distinction is clear, walking becomes more valuable because expectations are realistic. 2. Walking works best after strength, not before. Many specialists recommend doing light strength or balance movements first, then walking. This wakes up the muscles and joints, making walking feel smoother and safer. Walking afterward reinforces movement patterns instead of replacing them. 3. Shorter, more frequent walks are better than long, exhausting ones. Long walks can increase fatigue, which raises fall risk. Doctors often prefer moderate walks done more often, allowing seniors to maintain good posture and control throughout the walk. 4. Posture matters more than speed. Walking faster does not improve strength. Doctors encourage upright posture, relaxed arms, and controlled steps. This protects joints and reduces unnecessary strain. 5. Walking surfaces should be varied carefully. Once strength and balance improve, introducing gentle variation, such as slight inclines or softer surfaces, can help maintain adaptability. This is done gradually and intentionally, never rushed. 6. Walking should never cause fear or joint pain. Discomfort is a signal, not a challenge to push through. Doctors adjust walking routines when pain or instability appears, instead of increasing distance or speed. 7. Walking is a companion to training, not a replacement. When walking is paired with simple strength, balance, and control movements, seniors see far better outcomes. Confidence improves, endurance increases, and walking becomes something that supports independence instead of masking weakness. Doctors often describe this approach in simple terms: strength protects balance, stabilizes walking supports. When these elements work together, the body feels prepared for real life, not just exercise. And this brings us to the most important takeaway of all. Walking did not fail you. Your body was simply missing the rest of the plan. In the final section, we'll bring everything together and talk about what this really means for your independence, confidence, and quality of life moving forward. The real goal was never walking, it was independence. If there is one message doctors want seniors to truly understand, it's this. The goal was never to walk more steps. The goal was to stay independent, confident, and safe for as long as possible. Walking has value. It supports the heart, it clears the mind, it keeps you moving. But walking was never meant to carry the full responsibility of protecting your strength, balance, and stability after 60. That responsibility belongs to how you move, not just how often you move. When strength is restored, standing becomes easier. When balance is trained, fear fades. When controlled movement returns, joints feel protected. This is why doctors focus on preparation, not punishment. They don't push seniors to exhaustion. They guide them toward movements that rebuild what aging quietly takes away. And the most encouraging truth of all is this: you are not behind. You are not broken. You are not too old. Your body simply needed clearer instructions. With the right signals, simple strength, gentle balance challenges, controlled movement, and supportive walking, your body responds. Confidence returns. Daily life feels manageable again, and independence becomes something you actively protect, not something you worry about losing. This channel exists for one reason: to give you science-supported guidance that respects your body, your experience, and your goals. If this video helped you see walking differently, let us know in the comments. Tell us your age and where you're watching from, and share which part surprised you most. Your voice helps shape what we create next. And if staying strong, mobile, and independent after 60 matters to you, subscribe and stay with us. We're here to help you move with confidence today and for many years to come.